Hello, friends. Last week, I spoke at a conference titled Inclusive Care, Empowering and Engaging Caregivers as Partners in Care. What a great conference topic, right? And because I've been on both sides of the medical system as provider and caregiver, I was able to share experiences that I had from both vantage points. And I also learned that I have a lot more to learn about how to better advocate for caregivers within the medical system. Hello, I'm Dr. Renee Harmon. I'm the author of Surfing the Waves of Alzheimer's, a memoir about my husband's time with younger onset Alzheimer's disease. And today we're talking about that intersection with caregivers and the medical system. What do we need from each other? What do caregivers need from the medical system? And what does the medical system need from caregivers? So first off, caregivers need to be heard and believed. And I am chagrined that I was as bad as I was prior to my intimate knowledge with dementia. I could hide behind the fact that I wasn't prepared well in my medical education, but that's no excuse. Two of my favorite patients were an elderly couple, Mr. Fred and his wife, Miss Vi, not their real names. And Mr. Fred, over the course of, I think, a year, made appointments with me to specifically voice concerns about Ms. Vi's memory. And I would listen attentively and give him pointers, but I didn't take him seriously because I never saw or experienced anything with Ms. Vi when she was in the office for her appointments. Eventually, he wore me down, and I went ahead and did a mini mental status exam, and Ms. Vi did not perform well, and eventually I did diagnose her with dementia. And I still feel embarrassed by not giving Mr. Fred that full knowledge that he knew what he was talking about and what he was seeing at home. But after Harvey's diagnosis with dementia, I was much better at stating how seriously I thought this was and would encourage patients to make a follow-up appointment to look at this concern very specifically. Even if it was mentioned to me as an, oh, by the way, a statement every physician dreads to hear as you're leaving an exam room, I would point out that I felt it was very important and to please make a follow-up appointment so that we could address that issue specifically. And I would schedule extra time for that because it takes extra time to really do that kind of appointment really well. And I have found those appointments, those first appointments when we're really talking about memory loss, to be difficult for a number of reasons. One is if the caregiver or the family member, they're not a caregiver at that point, but if a family member comes with the patient and gives all this information about what they've seen, it makes the patient feel very uncomfortable. It makes them feel like they're being ganged up on. And if I start having a conversation with the family member, they can feel left out. So I found it much better to have a conversation with the family member on the telephone prior to the appointment or in the hallway, or sometimes I was even passed a note discreetly with information. And the better information was always very specific things that they had seen at home that they were concerned about, with dates and even a timeline if that was possible. As the disease progresses, it was even more important to have information from the family caregiver because the patient can't advocate for themselves. Sometimes patients would come to these follow-up appointments alone or accompanied by a paid caregiver, and I would still need information from the family caregiver at that time and would call them to get more information so that I could get a better rounded picture to come up with a better course of action. For myself as a caregiver, it was very uncomfortable for me to accompany Harvey and have the doctor turn to me and ask, so how do you think he's doing? And it was uncomfortable for me to share all these things I was seeing at home with Harvey sitting there. I always it felt like it made him feel embarrassed or accused, and I didn't like that. So next week, I'm going to talk about another aspect of this intersection between caregivers and the medical system, and I would love to hear from you. If you have been a caregiver or are a caregiver, what do you need from the medical system? What works? What doesn't work? What didn't work for you in the past? How can we be better as medical providers? And I'd love to address those. So leave a comment, send me an email, and I'll address those as well as some ideas that I have of things that I want to address. So be well and keep your balance. Thank you.